Hear me? We got you.
Yes.
There we go. There, even got a camera there. All right, we have everyone that we're expecting.
I believe so, yes.
Okay. Are you ready?
I am ready. We are ready and recording, so we should be able to post afterwards.
All right, wonderful, Nicole. We're getting us set up. Okay, I will call then the Tuesday, March 24, 2000 City Council meeting to order and ask Nicole to take roll call, please.
Blake?
Here.
Carberry Montgomery?
Bridget?
Carberry Montgomery?
I think you're muted. There we go.
Obrecht?
Here.
Kofi?
Here.
Russell?
Here.
All right, so we have everyone present. We're gonna keep this as normal as we can. So let's please all stand for the Pledge of Allegiance.
Allegiance to the flag.
United States of America.
To America.
To the Republic.
Which stands.
One
nation. Under God.
Indivisible. Liberty and
Justice for all.
And Mayor, if I may interrupt for a moment and just have, if everyone attending except for council members would please mute their audio. That may give us a little clearer input here.
All right, thank you. I will read the character count statement. Urbandale is a national leader in character counts, endeavoring at all times to promote and model the principles of trustworthiness, respect, responsibility, fairness, caring, and citizenship. Conducting tonight's meeting, we expect that all participants will act in a respectful manner consistent with these principles. Item 2 is to approve the agenda. Is there a motion? So moved. By Pogge.
Second.
Second by Russell. Discussion, roll call.
Pogge?
Yes.
Russell?
Yeah.
Blake?
Yes.
Carberry Montgomery? Obrecht?
Yes.
Thank you.
Okay, thank you. All right, item 3, presentations. I have the emergency proclamation that I'm going to read. Whereas COVID-19 disease that is caused by a virus that has been determined by the Centers for Disease Control and Prevention to be highly contagious and can result in serious illness or death. Whereas the World Health Organization has declared that COVID-19 has been characterized as a pandemic, meaning that states and governments should act appropriately to contain any potential outbreak. Whereas the Iowa Department of Public Health has confirmed community spread of COVID-19 in Iowa, significantly increasing the risk of exposure to Iowans. And on March 9, 2020, the state of Iowa declared a state of disaster related to the outbreak of COVID-19. Whereas on March 13, 2020, the President of the United States declared a national emergency to combat the outbreak of COVID-19. Whereas on March 17, 2020, the governor of the state of Iowa proclaimed Iowa to be in a state of public health disaster emergency and ordered the closure of all restaurants, bars, fitness facilities, and movie theaters, and prohibited the gathering of more than 10 people at all locations or venues to combat the spread of COVID-19. And whereas it may be necessary for the city of Urbandale to act quickly and decisively to implement the disaster response plan of any state or federal agency, or to otherwise act in the best interest of the residents and businesses of the city of Urbandale. And whereas Title III, Chapter 30.002B of the Municipal Code of the City of Urbandale and Section 372.14, Sub 2 of the Code of Iowa grant the mayor power to declare an emergency if public danger exists in the city of Urbandale, and to govern through proclamation to protect the health and safety of Urbandale's residents and businesses. So now, therefore, I, Robert Andeweg, Mayor of the City of Urbandale, proclaim a time of emergency exists within the City of Urbandale due to the threat of COVID-19, and do hereby state that the emergency power is granted to the Mayor of Urbandale pursuant to Title III, Chapter 30.002B of the Municipal Code and Section 372.14, Sub 2 of the Code of Iowa to take action to protect the health and safety of Urbandale residents and businesses, and to provide emergency assistance to those affected by this pandemic are hereby invoked. The city manager shall have the authority, in consultation with the mayor, to suspend sections or entirety city policies and procedures, including the employee handbook, to provide for the continuity of city operations, services, and welfare of Urbandale's residents and businesses and employees. This could include providing department directors the ability to solicit quotes and estimates for contracts necessary to combat this emergency, and have the city manager sign those contracts, adjusting human resource policies and practices for city employees to address their physical and financial well-being. And this may include telecommuting and flexible work schedules, modifying or closing city facilities, services, programs, and operations as necessary to protect the health of the city's residents, businesses, and employees. As soon as practical, the City Council shall be notified with respect to all actions taken under authority of this proclamation. Any action taken during this proclamation that would have normally required City Council action shall be presented to the City Council for appropriate action within 60 days of the termination of this proclamation. This proclamation shall take effect immediately and remain in effect until rescinded, modified, or superseded by a subsequent proclamation as future recommendations of the COVID-19 pandemic warrant. And signed this 24th day of March, 2020. Well, needless to say, that's the first time I've had to invoke those emergency powers, and I hope it's the last. But by the same token, certainly necessary, and we will, as I said earlier, the powers are to be used judiciously and sparingly, but still they are necessary, and they are there for a reason. So we have already implemented a number of these items administratively, and as we move forward and as this develops, we will see what further actions we may need to take. So, but with that, we have implemented this, and I just commend our staff and AJ for already getting us to the point where we are right now. I mean, this is a virtual meeting that we got set up. I think we were frankly ahead of the governor in arranging for this. We knew we would need to have this, and we got this in place. And then Nicole and James and everyone else to get this done. We're still doing business, so we're going to do business as best we can. We're going to keep things as normal as we can, but certainly it's going to be modified for the time being. So thank you everybody for rolling with the punches, and we're going to keep moving forward and keep doing business in Urbandale the best we can. At this time, I know we have Bob Brownell joining us today too, and Bob asked for a little time, and I thought it'd be appropriate for Bob to speak from a county standpoint briefly on items of interest from the county standpoint. So Bob, I'll turn over the floor to you at this point.
Thanks, Mayor. Can you hear me okay?
Mm-hmm.
Great. Robert Brownell with Polk County Board of Supervisors. Evening, everybody. First of all, what's going on at Polk County? We are still open. We will not close. We are here to serve citizens, as you all are. A lot of our citizens are of modest means, and they're the ones we're really concerned about because they depend on us for a lot of services. So we're going to stay open, but we'll try to be smart about it. Most of our workers, our employees have gone home to work at home. We have several on administrative leave to care for dependents, and their work is being done remotely also. We're doing screening at the county administration building and all county buildings, actually. And that's not a COVID test. It's just a test of temperature and then some questions. And if you have some business with the county, if you pass those tests, then we'll let you go in and call in some departments or offices. Many offices are closed. Assessor's office, for one, is closed, and some others are on limited services. So there's not a lot of traffic going in and out of the Polk County Administration Building, but we are open, as is River Place and some other places. I want to bring up to date on some things that are going on in the community right now. And one of them is 211 call center that you've probably heard about. The Emergency Operations Center was opened up a couple of weeks ago, actually 3 weeks ago, and your staff, Mayor, has been participating in this. Fire, rescue, law enforcement, and others have been participating and have been doing a great job. You should be proud. About 211 service is the service that we've allowed to set up for medical questions for people. This is an example of flattening the curve in a way, because we've taken over 3,300 calls in the past 8 or 9 days. Those are all calls that would have gone to emergency rooms or medical providers had they not gone to 211. So we've managed to keep that capacity off the medical providers, and they've noticed it and they're very appreciative. out of all those calls, we've referred only 10 people to emergency rooms. So it's really worked well, and it's done a great job. We want to integrate healthcare or mental health professionals into this service starting late this week, early next. We're quite concerned, as I know probably you are too, about the effects of isolation and anxiety that can take its toll on people that are fragile mentally and those that just don't understand what's going on exactly. So we're trying to integrate volunteer, at least, mental health professionals to work on the 211 line also, and maybe serve some people and help them out from emotional and mental aspect as well. Testing. We hoped for a stand-up testing clinic. That's not going to happen, at least right now. The reason why is because the number of kits in Iowa are just not enough. You've probably seen in the newspaper that there's less than 700 kits in the state of Iowa right now. We want to save as many kits as we can for hospital personnel, medical personnel, first responders, EMS, long-term care folks, and the like. But there are more kits coming in. We should have enough to continue to do what we're doing now. But right now, it's going to be clinic-based testing only. And I know that's disappointing to many of us, including me, that we couldn't go to more of a widespread testing regime. We look at it this way. In the past 4 days, we've tested 1,544 people. 1,465 of them have tested negative, or 79 positive, for a 95% negative rate. In the United States as a whole, we've tested 314,000 people. 265,000 have tested negative for an 84% negative rate. So when you're trying to, not hoard exactly, but try to husband your kits, you know when you walk in the door that if you have 10 kits, that 8 of them at least, maybe 9 in Iowa, are going to be negative, then you have to make some hard calls. And the calls we're making right now are in favor of trying to take care and make sure our healthcare professionals and our first responders and our long-term care clients and those kinds of people are safe. We'll continue to do clinic-based testing, and so that'll be how it's done. In Polk County, we have 17 cases of COVID-19, 0 hospitalized at this time. They're recovering at home. We had one guy in the hospital. He was released fairly quickly and is now at home. So the hospital capacity is pretty good right now. And all this to tell you that it's going to get worse. And I don't mean to be the downer here, but as based on the models that we've looked at and the timeframes involved, the numbers are going to get worse. They're going to go up. Don't be alarmed by that. This is the way it works. And if we do more testing, I think the numbers would clearly go up, but probably the percentages of negatives would also probably stay about the same. So well, I think we're in a good position overall. We have a good bed capacity in the hospitals right now, and that's a good thing. And my hat's off actually to and many thanks to the citizens of Central Iowa who are taking this semi-soft shutdown, if you want to call it that, very seriously. All you have to do is drive to work in the morning, drive downtown in the morning at 8 o'clock where the freeway used to be jammed, and this is practically empty. So people are taking this seriously, and we should be very proud of our citizens for what they're doing because it's really helping. But we do expect a surge that probably this weekend, Friday, Saturday, Sundays, the numbers are going to go up. And we'll see how much they go up. That's what everybody wants to know is how much do you think they'll go up? Well, nobody knows. And that's the one constant about this virus is that it's very dynamic. It changes. Things change every day. The things that we don't expect pop up, both good and bad. There's been some good things come out of this too, but we'll talk about that a little bit. But we do expect for a surge to happen this weekend and, keep doing what you're doing. Stay inside, wash hands. The virus hates clean, so stay clean and all that. I want to touch base on homeless. If Mayor Andeweg was tested positive, he'd go home and isolate in his home. If you're homeless, you can't do that. There's no place to go to. So we've done some things to try to alleviate the situation. We've moved 30 homeless folks into apartments across the metro. Polk County Housing Trust Fund has paid for that. Basically, that was first month in security deposits. Some of these folks are gainfully employed, and so they can pay the rent. They just couldn't get past the security deposits. We've taken care of that. We've moved 40 or so people, I think it may be more now, into a motel in West Des Moines out of the homeless shelter, and they will be there. They're not COVID patients. They're just homeless. Moved them out of there, and that reduced the Central Iowa shelter population to less than 100. The reason that's important is because now we can socially distance those folks down there and hopefully keep them from contacting the virus and then spreading it around as they walk around town or at least within the shelter. We have also opened up a quarantine facility for homeless at the fairgrounds. It'll be staffed by Community Family Youth Services and Broadlawns personnel, some other volunteers. This will be a place if one of the homeless does test positive, they can go to and convalesce, or at least be quarantined and stay out of the system. They have some place to go that's safe and warm and get fed and be off the street. I think there's a lot of public benefits to that. One thing I said that earlier that I think there's some good things come out of this. One of the things, regardless of what certain individuals are doing across town, I think the mayor would agree, regional cooperation has been really good. We have an EOC that's meeting every day. Municipalities are well represented, including yours, as well as the medical community, hospitals, EMS, law enforcement, and many others. There's meetings every day. I send an update to Mayor and AJ fairly frequently, and if they want to forward that on to the council, that'd be fine. Kind of describe when meetings are taking place, what meetings they are, and those kinds of things. But it's some of the best, but it is the best collaboration I've seen in my time since I've been on the board of supervisors. So that's a good thing. One thing we're doing as far as PPEs go and those kinds of things, the Polk County IT has put together a single point ordering system for every service, including masks, gloves, and so on. It'll all flow into one place. Hospitals, EMS, everybody will flow into one spot. The state will we'll send it up to the state for purchase. The state's been fulfilling orders at about 52%, which is not 100% obviously, but it's better than what we've been getting. And so I can say to you that the supply chain is catching up. We are going to get more PPEs in, and there's more people volunteering all the time with additional equipment and these kinds of things. So I think that's about it, Mayor. It's not the most positive thing I can give you, except I can say that I think we're in as good a shape as we can be in when it comes to hospital beds and preparedness that we can be. We wish we could do better. I think we all wish collectively that we could all do better with the testing kits, but we have what we have, and we'll move forward. We will get past this. I think there's a lot of concern about the economy, obviously, but I think the main concern right now is the health of our citizens and getting past the worst part of this, which we hope it's not this weekend, but we kind of hope it is. We can get past it and start rebuilding what we want to rebuild here and maybe get back to some semblance of our former lives. Anyway, if there's any questions or comments or anything like that, I'd be happy to field them, Mayor. If not, I'm wishing you good well.
All right. Thank you, Bob. Any questions for Bob from anyone?
Question. This is Bridget. I know the number of testing kits is really beyond your control, Bob, but how can we be projecting a increase in the number of cases if we're not substantially increasing the number of people that we're testing?
Right. Well, that's a good question. The way we do that, and it's not we, and not me personally, this is the medical professionals that are looking at the history of and the trends that have occurred other places that are on the same, maybe a timeline a little bit ahead of ours. So we know based on the number of people that we have right now that are testing positive, what that's going to be, as the weekend unfolds. We don't know what the infection rate is going to be here. Right now it's low, which is good. We've got over 70 counties with no COVID whatsoever. Obviously, this is not one of them, but unfortunately, but we do feel like the numbers that we have are good. They're flat right now, and if they were to stay flat, that'd be a miracle. And so we'll see. We're doing about 18, 19, 20 new cases per day, and if it stays at that level, that'd be a miracle. But we don't, based on history of other localities that are dealing with this, maybe a week or two ahead of us, we think the numbers are going to go up.
But my concern is still that, there's 70 counties that don't have any positives because probably no one's been tested in those counties. So I guess, this is probably just a much bigger discussion than the Urbandale City Council, but it's frustrating that we can be making any sort of projections when we're not testing hardly anyone. But there's a lot of smart people I know at Polk County Public Health. So,
yeah, I think that's right. And, I share your concern, Bridget. I really do. But I think your last statement is one that I want to amplify. There's a lot of smart people thinking about this at the hospitals and within Polk County Public Health and within these emergency operations meetings. I trust their judgment, and I think what they tell me, I think is probably accurate. So far, it's been very accurate. So I'm going to go with it.
Thanks, Bob. I do have to say I was on the emergency management call at 10:30 today, and it covered all the areas and disciplines, and I know our staff is, as Bob said, participating in that on a daily basis. There's also a daily situational report that's pushed out, I think, about 6 o'clock every evening, and I will send a link to that to everybody so you can see and read the daily situational report from Polk County as well. So. All right.
Bob wanted to add one more thing. I meant to throw this in. There's going to be a town hall meeting, so to speak, with medical professionals on Thursday from 7 to 8. I'll push that out to you and AJ, and then if people want to link into that, they can. It's going to be recorded. Media is going to record it and play it again. But if people want to watch it live, there's a way to do that. I'll push that out to you and AJ, and they can get out to the council if they like.
Oh, perfect. Thank you. Yes. All right, we will move on to item 4, the adoption of the minutes. Item 4.1, the minutes from the March 10, 2020 meeting. Is there a motion?
Moved.
Tell me,
That.
if just for point of order, if you could, because that's hard. I'm having a hard time understanding who's making the motion.
So moved, Matt Blake.
Okay, motion by Blake, second by Carberry Montgomery. Discussion, roll call.
Blake,
Yes.
Carberry Montgomery,
Yes.
Obrecht,
Yes.
Hoagie,
Yes.
Russell,
Yes. Okay,
Thank you.
thank you. Item 5 is the consent agenda. We have 5 items for approval. Is there a motion?
Pogie will,
Move Obrecht.
By Obrecht,
second by Pogie.
second by Pogie. Any further discussion? Roll call.
Obrecht,
Yes.
Hoagie,
Yes.
Blake,
Yes.
Carberry Montgomery, Russell,
Yes.
All right, thank you. That passes. Item 6 is a public hearing to consider the Waterford Landing amendment to the comprehensive plan and planned unit development master plan at 167th Street and Waterford Road. And Nicole, help me again. I know you sent this to me. The public notice for this was published.
March 13th in the Des Moines Register.
Okay, and there are no objections to that. Notice is published.
There were none.
Is there a motion to open the public hearing?
So moved.
So moved.
Motion by Carberry Montgomery. Who's the second?
Pogie.
Discussion, roll call.
Carberry Montgomery,
Yes.
Hoagie,
Yes.
Blake,
Yes.
Obrecht,
Yes.
Russell.
Yes.
Thank you.
All right, we will be continuing this to our next city council meeting, but the notice was published for this meeting, so that's why we open up the public hearing now. I will ask, however, is there anybody from the public on the meeting tonight that would like to speak to this item that cannot be at the next meeting?
I will note I did mute some microphones, so if you are trying to talk, please check your microphone if you would like to speak.
I think there's also a chat function on the bottom that you could use as well.
Okay. Well, we will, if for anybody who's not able to speak now or having a problem, we will be continuing this to the April 7 meeting, and we will have the opportunity for public comment at that time as well. So with that, is there a motion to continue this public hearing to the April 7 meeting?
Russell,
Matt
so
Blake.
move.
By Russell,
Second by Pogie.
second by Pogie. Discussion, roll call.
Russell,
Yes.
Hoagie,
Yes.
Blake,
Yes.
Carberry Montgomery,
Yes.
Obrecht.
Yes.
Thank you.
Thank you. That passes. Item 7 is to establish a public hearing. We have 4 public hearing establishments. Item 7.1 is to establish a public hearing for the development agreement with 8860 North Park Drive LLC. Is there a motion on that?
Move approval of resolution 94-2020.
Motion by Pogi,
Second by Obrecht.
roll call.
Hoagie,
Yes.
Obrecht,
Yes.
Blake,
Yes.
Carberry Montgomery,
Yes.
Russell,
Yes.
Okay, thank you. That passes. I'm sorry, Nicole, were you saying, did I speak over you?
oh, nope, we're good.
All right, item 7.2 is to establish a public hearing for the development agreement with Iowa Bankers Insurance and Services, Inc. Motion.
Russell, so move.
Okay, motion by Russell,
Second by Obrecht.
second by Obrecht. Discussion, roll call.
Russell,
Yes.
Obrecht,
Yes.
Blake,
Yes.
Carberry Montgomery,
Yes.
Hoagie,
Yes.
thank you.
Thank you. That passes. Item 7.3 is to establish a public hearing for the development agreement with Remark Enterprises, LLC.
Move approval of resolution 91-2020. Obrecht.
Russell, second.
Motion by Obrecht, second by Russell. Discussion, roll call.
Obrecht,
Yes.
Russell, Blake,
Yes.
Carberry Montgomery,
Yes.
Hoagie,
Yes.
That passes. Item 7.4 is to establish a public hearing for the development agreement with Unity Center Point, LLC.
Move approval of resolution 92-2020. Obrecht.
Russell, second.
Motion by Obrecht, second by Russell. Discussion, roll call.
Obrecht,
Yes.
Russell,
Yes.
Blake,
Yes.
Carberry Montgomery, Hoagie,
Yes.
Thank you. That passes. Item 8 are our regular agenda items. First is item 8.1, the equipment purchase for the 15-passenger high roof van. Your motion.
Council, I move council letter 6289.
Second, Blake.
Motion by Russell, second by Blake. Any further discussion? Roll call.
Russell,
Yes.
Blake,
Yes.
Carberry Montgomery,
Yes.
Obrecht,
Yes.
Hoagie,
Yes.
thank you.
Thank you. That passes. Item 8.2 is the contract for EMS billing and accreditation software.
Move approval of council letter 6295. Obrecht.
Second by Pogi.
Motion by Obrecht, second by Pogi. Discussion. Roll call.
Obrecht,
Yes.
Hoagie,
Yes.
Blake,
Yes.
Carberry Montgomery,
Yes.
Russell,
Yes.
Thank you. That passes. That takes us to the end of our regular agenda tonight. Thank you for participating in this historic first virtual city council meeting of the Urbandale City Council. We'll remember this day. So with that, turn it over for mayor and council items. If I can remember the dais order, I think David, you're up first.
Just say everybody, stay safe and wash your hands.
There we go. Thank you. Matt.
First, I want to say kudos to the city of Urbandale and the staff on all your work. I know the mayor said it, but I would like to reiterate it. It's been great, the response that you've been doing. And then secondary, I didn't know if I should bring up during mine or others, but again, I think I posted about this on my Facebook, but I've been professionally dealing with the COVID-19 breakout crisis with my professional side with the nursing facilities, and it's been quite hellish over the last couple weeks regarding the amount of content that we're pushing out. What I thought was interesting, and I wanted to just bring it up as a perspective of what could be if and why these what we're doing is necessary, is that I was communicating with my counterparts in New York State today, and for those that don't know, half of all the COVID cases in the country are in New York State. He was running down that in one day they added 4,790 new cases. They have 3,000 people hospitalized currently. They have 210 deaths. They think that they will peak in the next 2 weeks, and that they will expect 140,000 people to be in beds, and they only have a capacity of 53,000. They're going to need 3,000 ventilators, and they only have 7,400. So things could get really dicey. And I'm only bringing all this up is that the measures that we're taking right now are keeping us from going down this road, hopefully, because they are on the exponential curve up. And hopefully, and I think Mayor and I think everybody in the state that has been taking these precautions, because this is what we're trying to avoid. So I think Bridget has something that I was covered on, but I'll let her bring it up when it comes to contact by the school board member, but I'll let that, I'm sure Bridget will bring it up. So I will quit talking.
All right. Thanks, Matt. And if you see any information, you're professional and you think is relevant from the city end, please let us know too.
Absolutely.
Okay, with that, Ron?
I just had a question with the going to shifts with public works. Are we going to maintain our existing schedules for collections?
This is AJ. Hopefully you can hear me. I know you can't see me. And I do have pants on, Matt.
I can hear you then.
Okay. Yes, our main emphasis will be on refuse collection. And since that's a little bit more of a specialized skill set, we want to make sure those drivers are protected. So we are going to rotate through enough that our daily routes will not be interrupted. The good thing about their job is that they have little or no contact with the public. It's all automated. So, but yes, that's when we came up with our discussions yesterday, that was the primary emphasis, to make sure refuse collection gets taken care of.
Okay, thank you. And other than that, I just want to say, express my thanks as well to the city. I think you've done a great job, and hopefully it will continue. And I'd love to say for another week or two or something like that, but I don't think anybody knows. So thank you.
Thanks, Ron. Bridget?
Of course, I have a few things to say. First of all, I'll echo what everybody else has said, thanking the city staff. I think we've been way out ahead of some of the other suburbs that I can tell in terms of just communicating things to the public and even to the council. So I really appreciate that all the hard work that everybody is doing, from the trash collectors throughout all the departments. So thank you. My second comment was just to let you know that DART passed a similar emergency operations order. I think it was last week, giving the and the executive committee the ability to do similar things as to what we approved tonight with the emergency operations order. Two other things. One, we had several economic development agreements on tonight's agenda, setting public hearings. I was hopeful that at our last lunch and learn, we were going to have a chance to talk some more about these agreements, or agreements in general, especially in light of what happened with Hy-Vee right before all of this happened. If we could get, for especially us new council members, some more specific information out to us regarding how these agreements operate, how people have to qualify for them, and most specifically, if there are any job requirements tied to them. And then my last item that I wasn't going to bring up, but Matt said I had to bring it up, The members of the Urbandale City Council or school board have reached out to me to talk about whether or not our crossing guards are going to be getting paid during the time that the school is not in session. Urbandale School District is paying all of its part-time employees, non-salaried employees, including paying their bus company to pay their bus drivers. So there's some concern from parents that our crossing guards are not getting paid. I started a discussion with AJ late this afternoon, but I would like to continue that, and I think we've talked tomorrow afternoon about it. That's all for me.
If I can, real quick on the DAs, we can certainly get some general information out, particularly for the new council members, concerning the parameters in which we enter into the development agreements. I'll have Curtis and his staff put something together for everybody. Again, appreciate the fact that we have 3 new council members, and the development agreements are fairly standardized, but I will tell you that none of them have in there any employment relationships with any of the companies, and we can go into that with the material that we provide to you, but I can just let you know off the top of my head, that's one of the things that we've never included, but certainly we'll put together an informational sheet for all of you to review.
Thanks. Adam.
Yeah, I just want to continue to echo just the great work that's been happening from my new home office location on my back porch. I get to see a lot of the park staff and the work they're doing. So just appreciate to see everybody out that should be out and about and protecting those of us that are staying home. So thank you.
Was that the bird chirping on your porch that I just heard there?
It may have been there. I've had a crazy blue jay try to get into here for the past couple of days. So
okay. All right. Well, thanks everybody, and I'll just sum it up by saying thank you again to everyone for adapting and working and really representing our city in so many different ways so well over these last weeks, and it's gonna continue for the time being, and we're gonna have to learn and adapt as we move forward, but we'll get through it. We're gonna be fine, and we're gonna be fine because we stick together when we work together. So and I especially want to thank our staff for everything they've done and what they're doing. You know, the other part of this that we really haven't talked about is, but consider our first responders out there too. So they're out there. They have to be out there on the streets, and they're risking interactions, and we want to make sure that they're safe too. So we'll make sure that they continue to have the equipment that they need to do their jobs too. But have a lot of folks out there that need to be doing their job every day. They don't have the ability to do that from sitting in home. So we'll keep them safe, and we'll keep everybody moving as best we can. So, and remember to support our small businesses in Urbandale too as best you can, given the circumstances. So, that's it. Is there a motion to adjourn?
So moved by Poggi.
By Poggi.
Montgomery.
By Comrade Montgomery. Any further discussion? Is there a roll call? We'll do a roll call.
Hoagie? Carby Montgomery? Blake?
Yes.
Obrecht?
yes.
Russell?
Yes.
All right. Thank you, everyone. Stay safe. Have a good evening. Appreciate it. Thank you.
Thank you.
Good night.
Yeah.